Hello everyone. Um, okay, before we start talking about the new chapter, I need to address this incident in our class. Um, as I sent an email to everyone, I was reported not just by a single student, but multiple students reported me regarding this unethical behavior happening in class. So, what do I think about cheating? Well, just like all of you, I think the same way. Cheating is a systematic problem which we try our best to prevent. So, cheating is not cool at all. And I was writing, what do I want to tell you? But in general, when you think about cheating or plagiarism in academic world, academic work, it's offensive to instructor. Now, for example, was I angry? Not really. Was I disappointed? For sure. Because I felt offended. I felt deceived. Because I spent more than 4 to 5 hours just to create a 1 hour video lecture with those questions embedded. It's a lot more time consuming than going to a class and teaching 1 hour 15 minutes, because it's in real time, you get to interact with students and everything happens in real time. Versus online, I have to test so many approaches. So if you're not familiar with what I do, I have to create the PowerPoint, then create some questions, include the question content, make sure that you have enough information to answer those questions, then put them into a Camtasia, I screen record. Then I have to convert that into a video file, upload that video file to PlayPosit, take it there and time them to place those individual questions, type the answers and time them accordingly, put the setting for each question and save. And this happens every time I create a video. That takes about, on average, 3.5 hours to 4 hours just to create 40 minutes to 50 minutes video. So it's quite some time I dedicate, and I enjoy doing that. I still do. But when I hear those news, students, just a handful of students, those who are bypassing reading the chapter, watching the video and directly getting to the question without reading the content or listening to the lecture, and also posting answer to those questions on social media, that is very offensive to me, because it shows that no respect to the effort I'm trying to put on this work and teach my class and give them learning environment, and you're taking away other people's learning opportunity as well. So to institute that I belong to and to myself, it is offensive. It violates academic policy. This is a lot more severe in certain classes. I decided to warn the entire class, especially those two individuals who may be not aware that what they're doing is affecting other students. But not knowing does not mean students are allowed to violate these rules. So the class, the materials, the exam tests should be individually tested, and you should let other people try as well. As much as you put effort, let them put that effort, let them find the answer, let them try to learn themselves. And if they ask for help, it's definitely good to guide them, but not just providing the right answer or sharing the answer, but like discussing in a more productive way, right? So you don't want to violate those academic rules, policies that could lead to severe penalties. And I have reported plagiarism in past, and it doesn't go well. Just as much as a lot of students may feel that this is not cool, and I received quite a few comments from students. They are happy that I took this action because it's a necessary action. At the same time, it's not a pleasant experience to talk about this. Unfortunately, I had to, and I did. It's unfair to honest students. Majority of my class, especially this 3390 class, majority of the students are doing their work and they are completing their assignments on time, putting a lot of effort, spending a lot of time reading the chapters, and also completing the assigned PlayPosit video and answering the questions. And I really appreciate that, and I want you to keep up that by changing those minor rules. Making exam and quiz through lockdown browser takes away that unfairness. Students, those who are, I don't even like to call those individual students, because you're not showing that quality, right? If you are violating academic policies. So individuals, those who are violating those rules, unfortunately, now they have to try harder. The students, those who have been honest, reading their materials, watching the video, answering those questions, getting them right, I don't think it's any harder for you, because the amount of time you spend for the lecture is still the same, 1 hour, not even exceeding 1 hour, 5 minutes. And the attempt that you made, if you watch that video in one attempt, you took some notes, you have your notes from chapter reading, you already do the same thing. Nothing changes. It's just a minor adjustment by taking those quizzes through lockdown browser, which prevents, and I'm trying my best. People might still find other sneaky way to do it. It's shameful that things happen like that, but I'm trying my best to avoid those unfairness for cheating, unfairness of bypassing reading and listening to lectures. So that changes are made or put in place to remove those unfair action happening from some of those individuals. And it's a shameful and selfish act. Shameful because you committed to this class, and most of my students, they are putting their effort, energy and time to learn something from this class. And some of those individuals who've been reported or involved in this academic dishonesty, it's a shameful action for them. And it's selfish, because if you did the exam, if you took the test and you shared the answer, the students, those who are willing to read and learn themselves, you took that opportunity away. Because asking one question out of 4 questions out of 40 minutes doesn't test anything. What happens is those students is like abetting, right? Encouraging to do wrong thing by giving the answer and skipping the whole content. Unfortunately, when it comes to real life example, real life situation, you would never know why certain principles are applied, what does even terms mean. Like we talked about bipolar disorder, you might continue to have the confusion, why there is 2 bipolar disorders, because we discussed about these, we discussed about symptoms, we discussed about causes, and you just look at one question and found the one answer, not even know the other options. You're taking away that opportunity by this selfish act. So definitely that's how I condemn, and that's how I see. It takes away other students' learning opportunity, and most students are willing to learn, and that's why you're committed to this time. 1 hour 15 minutes twice a week, and reading, and on top of many other responsibilities, you're taking this class. And I really appreciate those students who continue to put that effort. And cheating takes away that opportunity. So not fun, not cool at all. And creates closed mindset and kills learning mentality. Like those quizzes, again, is not going to test how much you learned in that 40 to 50 minute lecture or from the entire chapter. It is to test you whether you are paying attention. And if you just give them answer, that is indirectly, vicariously discouraging, hey, you don't need to do that, here's the answer. You can just totally skip the video or just go to the answer. Not fun at all, because you learn a lot more than just finding those answers in those brief video and also reading the chapter. And lastly, gains zero knowledge of the content. Man, cheating is such a cheap action. It doesn't give you real knowledge, critical thinking, or application about the content. It just skips the entire process of learning and destroys that learning environment, and cheating on their own future. So individuals, those who engage in plagiarism or cheating in class, in assignment, in any form, they are destroying their own future. Because think of like you becoming a therapist or any kind of a helper. If you lost this opportunity in this introduction class, this is introduction class, and those individuals might continue that habit in other classes as well. When you go to work, when you have to talk to clients, and those individuals may be like a lot, now how are you going to cheat? Right? That's what I think of. Like, if you started doing this so early on in your career, in long run, I don't see you're excelling in your career or your skills. So bottom line is the new changes, I hope, I'm very hopeful the new changes that I put in place should help to reduce such unfairness in this class. And if you see any of those things happening, just like the few students those who reported to me, I'm really grateful to them. I would never know what's going on, and they brought this issue to my awareness, and I am taking this action to remove such unfairness to my students, those who are working hard, those who are dedicated to learn from this class. And I am with you. I will continue to support your learning, and I will continue to facilitate this learning environment. Please condemn those actions, cheating or plagiarism. It's never acceptable, no matter how busy you are, no matter how hard it is, because I could keep writing bullet points here. It takes away great opportunity of learning. We are in college, we are dedicated to learn, we are dedicated to aspire for greater future. Please continue to do so, and if you see any of those things happening again, I will definitely address them. Please send it forward to me if you see anything, if you hear anything. Your identity will remain very confidential and anonymous. I will definitely address. I don't like any unfairness in my class in terms of learning. We all learn in a different pace, different level of skills, but we all deserve to have equal amount of opportunity. So please keep that in mind, and avoid and refrain from encouraging or engaging in such action that is so condemned and that is so not cool at all. Thank you. So let's talk about the chapter for today. Now we'll talk about, in this lecture, eating disorder. One of the most dangerous disorder that could kill people easily. When you look at the chapter, one thing I love about this textbook is the beginning paragraph. Every time you read, you go back and see, it immediately brings our attention to the issue and pragmatic concern about it. Now, same thing happens in eating disorder, right? What do you think? Is it possible for humans to take their body for granted? Is there anything that would impose threat to our activities of survival? Well, in one part of the world, we see that people die out of starvation, and on the other part of the world, there is abundance of food, right? And when I think of issues like starvation in certain region of the world, I don't think that has we consider them dying out of psychological issues. It must be purely lack of necessary nutrition when you think of people dying out of starvation. In the Western world, however, the concern of death is different. Isn't it alarming to know that eating disorder can kill people 50 times faster than other individuals who try to die by suicide without eating disorder? That alone is scary information to me. Another way to see this is that eating disorder is dangerous, right? Now, we eat food all the time. We know after many years of practice how much and how frequent one should eat. If we don't know exactly how much we should eat, at least our physicians will recommend to adjust our needs. We want to eat but also stay fit and thin. That is again influenced by cultural and mainstream media. What if we are not eating enough but continue to lose weight to remain or become slim and thin? Now that's where like a red flag starts. Oh, okay, you're not taking enough food, but now you're trying to stay thin and continue to lose weight. That could be dangerous, right? Isn't that good motivation? Maybe not, because people start to develop abnormal behavior around that concept. I should stay fit, I should stay thin mentality. So when you look at eating disorders, especially we will be focusing on bulimia nervosa and anorexia nervosa. Bulimia nervosa, where people eat too much, out of control episode, also called binge eating, then engage in purge or self-induced vomiting behavior. They're trying to control something which we will see at, in detail, and when you look at etiology, and maintain their body size or figure. And anorexia nervosa, we will talk about, is some people eat so little and work out too much to control the food intake, which is already below daily requirement for their healthy body maintenance. And binge eating disorder, some people just eat a lot and find it disgusting, then suffer about the same behavior. So that's another fascinating disorder, right? So binge eating, anorexia, bulimia, these are major eating disorders that we will be talking. Well, let people do what they think is the best for themselves. Isn't that the good approach? Why bother? Well, the issue of eating becomes concerning when we look at the death caused by eating disorder. Just like I mentioned earlier, it increases chances of people dying by suicide 50 times more than when you don't have eating disorder, right? And anorexia nervosa alone seems to have the highest rate of death. It's about 20%. That means at least 2 out of 10 people die untimely because of anorexia nervosa. And out of those 20 people, 20 to 30% of them, their death is due to suicide. The other is mostly malnutrition and other physical health issues. But if you take those 20%, those who die untimely, out of those 20% of them, that's like about 4 of them, is trying to kill themselves. And this is about 50 times higher than the risk of death from suicide in general population. So very high. If you take 10 people with eating disorder, 3 to 4 people would try to kill themselves within the course of their life. And the problem is relatively new in the Western world. The concept we're talking here, eating disorder, it's somewhat newer, but not that new. And it started to increase since 1965 to 1995. And this is no brainer for us if you know the value and meaning applied to food in the West and the rest of the world. In the West, food is abundant, easily accessible, and my personal opinion is that what value do we attribute to food and their contribution to our well-being? That's slightly different because I myself was born and raised in the Eastern world, and we have very different mentality about food. We grow our food, and we have somewhat, I would say, like a little extra value added to food than when you just purchase and you rely on not knowing the source of food. I don't know, again, this is very personal opinion. Your attitude matters. That's my point. But when you look at eating disorders, you definitely see the concern is not the value of food or attitude toward food. It's more about your perception of how you look, right? Bulimia nervosa was once in rise, and now anorexia nervosa seems to trouble people who are born in 1972 or between 1972 and 1985 than the older folks, because eating disorder was officially added in DSM-4. Now it seems to trouble younger folks. Now if you look at the distribution of this disorder, 9 out of 10 people are young women. They seem to be from the urban and socially competitive environment. In these individuals, sometimes there are evidence that they maintain and perpetuate the problem because there are certain platform like Pro-Ana or Pro-Mia or Thinspiration. And if I looked up these websites, they do share and pride on those problems. Unfortunately, and I'm not trying to tell you, you should look this up and see what you can do, but at least get a perspective. How social network can give individuals to inspire in a very unhealthy lifestyle and perpetuate this problem. And this social media, social network, in fact, is perpetuating the problem than solve it. So be cautious when you visit these websites or talk about them. And the biggest contributing factor to eating disorder that we will see is socio-cultural factor and less of psychological and biological factor. It doesn't mean that it's absent or no psychological and biological factor. It does play a role, but you see majority comes from socio-cultural factor. In fact, that is why the eating disorder now it's started to spread in certain developing countries as well, but it is mostly concerned in the Western and the developed countries than the other part of the world. Now, these eating disorder, like I mentioned earlier, anorexia, bulimia, anorexia, and binge eating disorders. Those are three major eating disorder types, and we'll see one by one. There are two prevalent eating disorder. Among them is bulimia and anorexia. Now, bulimia is a dieting results in out of control and with binge eating episodes that are often followed by compensating for intake. That the people eat, that happens right after they eat, they engage in this compensatory behavior, either through purging the food, through vomiting, especially induced vomiting, or other means, or through trying to make up for those intake by exercising or and fasting, right? And anorexia nervosa, in which food intake is cut dramatically down, resulting in substantial weight loss and sometimes dangerous low body weight. Both bulimia and anorexia nervosa can lead to very serious medical consequences, sometimes with potentially fatal outcomes, right? And there is severe disruption in eating behavior in all of these, because if you look at individuals with anorexia or bulimia or binge eating, there is a major concern with the weight and shape they have about their self-concept. It is very disproportionate influence in their self-concept, extreme fear and apprehension about gaining weight, strong social cultural origin, and that's why it's more driven by Western emphasis on thinness. Both BN and AN, bulimia nervosa and anorexia nervosa, like a chief motivating factor that is overwhelming to be thin and stay skinnier. And in binge eating disorder, a pattern of chronic and repeated binge eating happens, but what distinguishes it from bulimia nervosa is that the absence of compensatory behavior. So somebody eats a lot out of control and then they don't engage in compensatory behavior, we call it binge eating. And we'll see what constitutes binge eating. And they have this disordered eating behavior. They involve, they have this cognitive distortion about weight and shape as well. Now, we'll look at one by one. We don't need to focus so much on obesity because it is not officially listed as a psychological problem yet, but it could qualify. Obesity could qualify for a psychological problem. Now, when you say obesity, it's 70% of the United States adults are overweight and half of them meet criteria for obesity. And we use body mass index to define whether you are overweight or now you are obese. That means, if you look at the chart and you look at your height and weight, if you are sitting with 10 people, 7 of us are overweight. So that's not surprising. Most of us are overweight, like more than half, right? And out of that 7 folks, 3 to 4 of them are obese. They exceeded the overweight line and now they are obese. and it doesn't, I don't mean to scare you, it's a fact about overweight and obesity. In addition, across the nation, 1 of 3 people is working on diet due to their this fact. They're overweight, or either they're overweight or obese. Now, sounds scary. Why does it concern us? Well, BMI is and I call it like a dirty and handy tool to see if individuals are in a certain weight that can also be predictive of many other serious physical and sometimes psychological problems, right? If you are beyond your weight limit, you're more than likely to develop cardiovascular disease, risk of early death, because you are now prone to other injuries and other problems, physical health problems. So that's why it's concerning. Why can't just we ignore and enjoy, eat and not eat? Well, the eating is issue related to many health risks. That's like mentioned before. It can increase the risk, prevalence of cardiovascular disease, diabetes, hypertension, stroke, bladder disease, respiratory disease, muscular skeletal problems, and hormone-related cancers. So we should be concerned about obesity, and we should at some point, probably in DSM-6, will be accounted for psychological disorder, because anything done in excess could qualify for psychological disorder, right? When we don't sleep too much, that becomes a problem. When you engage in too much any exercise, that becomes addiction. Drinking alcohol becomes a problem. Sex becomes a problem. And if you look at obesity, there are biological factors, and that could lead to impairment and distress. So we might be able to see obesity in DSM-6 in the future, and possible diagnosis and perhaps it's very scary because the number is very high. Now, if we ignore the intake of food and output of calories by exercise, the underlying issue in obesity is excessive eating. That's number one. And this alone is a strong rationale to include obesity as a disorder in the text. That's what the textbook is arguing, and it makes sense because you're eating out of control. There is biological factor, and that could lead to, excessive eating could lead to impairment and distress, right? So keep that in mind and worth thinking about it. Now, binge eating episode, what constitutes a binge eating? Now, if you look at bulimia nervosa, there is binge eating. Binge eating is the hallmark of bulimia nervosa, and also binge eating disorder. Eating in a discrete period of time within any 2-hour period, an amount of food that is definitely larger than what most people would eat in a similar period of time under similar circumstances. That is what defined as binge eating, right? And there is another part, a sense of or perceived as lack of control over eating during the episode. So in that 2-hour time, you feel that you can't help cannot stop eating, your control is not there, and you engage in that excessive eating. And most of the time, they eat junk food, not vegetables and fruits, but mostly high caloric food. And when you do that, maybe associate with the guilt, shame, or regret. Now, if you look at the case example in our textbook, I think the name is Phoebe. That is such a fascinating story. Her successful life, successful career didn't matter. She had her own perception, and she had this guilt and shame in her mind. That belief that her weight and body shape influence her popularity and not other actions. So that continues to haunt these individuals. And they may also hide those behavior from other family members, and they often consume or often intake mostly sugar or fat or carbohydrates than other healthy food items. And the most significant feature that makes it bulimia nervosa, if you compare to, that's what I meant by covert, because they're not sharing or showing that behavior. And compensatory behavior is the another significant feature or prototypical symptom of bulimia nervosa, because they engage in this behavior to make up for binge eating, right? The most common compensatory behavior is purging techniques. Purge techniques is not only the one that is necessary for diagnosis, but most commonly used in bulimia nervosa. And most common purging technique is self-induced vomiting. And only when you engage in vomiting, unfortunately, after you take food, as fast as you eat, now they engage in self-induced vomiting. But you can only remove half of the food that you have taken. And if it is late, that's not even happening. Not even half is removed. And self-induced vomiting right after eating, right? Either they use laxatives or diuretics. Now, when you abuse laxative, it comes with some price, right? If you think of constantly using these substances to stimulate vomiting, you're more than likely to have more body fat, intestinal disease, because you abuse laxative. And when you constantly stimulate vomiting, repeated vomiting, that could lead to salivary gland enlargement. That's give chubby facial appearance, which is exact opposite of what they were trying to avoid. And constant vomiting also cause some erosion of dental enamel on the inner surface of the front teeth. And it also can produce, like mentioned earlier, electrolyte imbalance. And this disruption of sodium and potassium level, which in turn can lead to potential fatal cardiac arrhythmia. The heart is not working in a normal way. So intestinal problem resulting from laxative abuse are also potentially serious. Some individual with bulimia also develop marked calluses on the fingers and back of hands resulting from effort to vomit by stimulating the gag reflex. Now, these are really concerning medically. In addition to these medical issues, there are some possible comorbid psychological disorders. 20% of them meet criteria for mood disorder. 50 to 70% have met criteria for mood disorder at some point. And 80% have met criteria for any anxiety disorder at some point. And these individuals are more likely, 2 in 5 people are likely to abuse substance. So it comes with a lot of price for these individuals to have this issue. Now, bulimia, just to summarize, there is binge eating episode and followed by compensatory behavior. They also share this idea that they cannot control this behavior. They try to hide it from other individuals, and also trying to control their body weight by engaging in compensatory behaviors, for example, purging. How does that make different when you compare it to anorexia nervosa? In anorexia nervosa, the hallmark symptom is extreme weight loss. They are on restriction of calorie intake below energy requirement. For a healthy person, we typically know that it is about 1800 to 2200 calories should be consumed every day just to maintain your body, right? Depending on what you do. If you're an athlete or any other sportsman or sportswoman, you do need to take more than those calorie recommendation. But these individuals who have anorexia nervosa, they seem to be 15% below expected weight for their given age, and their fear is about weight gain. And they often begin to diet so early on because they want to control their weight. And the most common reason that anorexic individuals generally do not seek treatment on their own is that they do not truly believe that they are too thin, because in their perception they are pretty overweight. That's why they continue to diet, they continue to fear about gaining weight. Look at defining features. Just the same story here. They have very strong disturbance in body image, and because of that they continue to intake minimal amount of food, and they also engage in vigorous exercise to offset food intake and their overwhelming desire to be thin. Now that again leads to some physical consequences. For example, cessation of menstrual cycle. Starving body borrows your energy from internal organs, leading to organal damage including cardiac damage, and also can cause heart attack. Now other medical consequences, some are really scary. Loss of periods in women, dry skin, brittle hair and nails, sensitivity to cold temperature, cardiovascular problems, electrolyte imbalance, and this is one of the most common mental disorder that could lead to death due to organ damage. In addition to physical consequences, there are about 70% of them who have experienced depression at some point, and they also tend to have higher average rate of substance abuse and also obsessive compulsive disorder. Now, again, if you compare to anorexia nervosa and bulimia nervosa, compensatory behavior is the defining feature that is required in bulimia nervosa. In anorexia nervosa, you're trying to restrict intake of food to control weight. You might see some of these compensatory behavior like exercising and dieting, but not necessary for diagnosis. Now, the other disorder, new disorder in DSM-5 is binge eating disorder. A pattern of chronic and repeated binge eating happens, but in compared to bulimia nervosa, there is no compensatory behavior involved or followed binge eating episode. Individuals who experience loss of control of their eating and consuming great quantities of food but do not engage in any attempt to compensate for their binge eating disorder, right? That's what binge eating disorder is defined. And just like other two eating disorder, this could also lead to distress and functional impairment or dysfunction, and definitely lead to health risk or feeling of guilt. Now, excessive concern with weight or shape may or may not present. In compared to anorexia, you see that is the difference here. Now, if you look at some statistics about binge eating disorder, approximately 20% of individuals in weight control programs suffered or who is suffering from binge eating disorder. If we compare binge eating disorder with anorexia nervosa and bulimia nervosa, you would be able to tell the difference in these categories. Individuals, those who receive treatment in this anorexia and bulimia nervosa, they seem to respond less to treatment, versus individuals in binge eating disorder, they seem to respond better. And if you compare the age, individuals with binge eating disorder seem to be older than anorexia and bulimia nervosa. Now, if you look at the diagnostic criteria, just similar to bulimia nervosa, the only missing symptom here is absence of compensatory behavior. They engage in this binge eating episode associated with 3 or more of the following: eating much more than normal, feeling uncomfortably full, large amount of food, and so on. And this experience, of course, like when you're hungry, you do eat a lot, right? But this is leading to distress, the sense of guilt after eating. There is also distress regarding binge eating. Now, sometimes individuals call like stress eating. It may be different because, again, if you were to meet these criteria, the problems should continue for a while. It's not just like one time or twice. And also you continue to engage in that behavior too often and lead to sense of guilt, sense of embarrassment for eating a lot. And that's why those individuals hide from other folks to eat mostly lonely. Now, let's take a look at causes of eating disorder. If we consider eating problem is mostly prevalent in the Western culture, then that makes a strong connection with what kind of social cultural values do we have. In addition to social cultural pressures, the causes could also relate to possible biological and genetic vulnerabilities. For example, that this disorder tend to run in families, and some psychological factors could be low self-esteem, social anxiety, the fear of rejection that's very strong, and these individuals may have distorted body image. Relatively normal body weight individuals view themselves as fat and ugly. That could be a strong reason to restrict their diet. And the other internalizing problem is another factor that is worth mentioning here, because sometimes people cannot control external environment. They tend to turn inward and control what they can, which is one of them, of course, their body intake of food. Now, when you look at the social dimension, how this culture is portraying beauty or the standards of ideal body. Now, I mentioned this before, Killing Us Softly. Uh, Killing Us Softly is a documentary that has, I think, about 4 decades of information. And this documentary explains how American culture has portrayed female body. Now, in media, if you look at them, thinness is always linked to success and happiness. And when you look at media standards of beauty, they're increasingly unattainable. Why? Well, for average woman to get that zero size, I don't know how to do that. And it's extremely so much pressure on individuals to achieve that goal. And standards of ideal body, in fact, this is interesting if you look at the difference between boys and girls, at the when they hit puberty. The fact that puberty brings boys' bodies closer to the societal ideal and girls' bodies further from the societal ideal. That put little pressure on women and girls to maintain or even achieve that standard. And this standard frequently changed to make it more difficult. If you look at media, prime time situation, like comedies, movies, shows, they often feature women dieting and they continue to complain about their body weight. Magazines you take out, when I go to library or any e-library, you see that models are thinner than average women. It's almost impossible to be that size. And men on TV are more likely to be overweight than women, and the media has, the very strong impact on body image. And if you compare to how this information is portrayed, well, there are some interviews that, this is not research, but some interviews they have done on models. They say that the person they see in those pictures and advertisement and movie, it's not them, because it puts so much pressure on achieving those goals. And sometimes they use dietary supplements that can lead to serious problems, such as binge drinking or any other drug abuse, right? That's another issue. And adolescent dieting lead to an 8 times greater risk of developing eating disorder. Now, at that age, typically your brain is still developing. You're supposed to consume enough nutrition so your body can support your growth, and you continue to restrict those diet, that could lead to eating problems. Adolescents tend to internalize the standards of friendship groups, especially teenager is more likely to diet if their friends also diet. That's a peer pressure. It could be modeling that they're learning from. And the interesting fact or paradoxical fact here is when you restrict so much, that could lead to weight gain. And when women are asked to identify the most attractive female body weight, they typically identify a weight that is lower than the weight identified by men. So if you look at the social norm and how women perceive what is attractive, there is a significant difference between male and female assumption of their body weight. It can also produce stress that can also lead people to withdraw from certain food. And again, if you think of how food works, well, more you restrain from it, there is, neurologically, there is a dampen of dopamine because you didn't receive it, just like in addiction. And when you have that addiction, you don't receive what you wanted, that could lead to increasing craving for food and diet, that you are restricting. And during period of restricted food intake, people become preoccupied with food and eating because you stop yourself from feeding those food. And if you look at the family, another important factor here is parents with distorted perception of food and eating may restrict their children's intake as well. Now, that's another anecdote, not a study, not a research, that I have a family member who recently, had a baby, and she is not giving certain food to this newborn. And she's already imposing some concern about gaining weight. And it's really fascinating to me, because how people develop this idea of perfection. right? And they also don't talk about this openly. There's a no open communication. And if you look at different sport and different activities, ballet dancers seem to have highest incidence of anorexia nervosa. They continue to diet, and they seem to be unsatisfied with their family members because these rules and regulations are imposed. And families of individuals with anorexia are often high achievers. They are concerned with external appearances, overly motivated to maintain harmony, leading to poor communication and denial of the problem. And this disorder, eating disorder, also strain family relationships, which means it could cause parental guilt and frustration, and also associated with poor outcomes. And if you look at biological aspect, although there are still limited studies about biological factors, there are some biological influence in development of anorexia nervosa and bulimia nervosa. If you look at genes studies, some genetic component, like when they compare to individuals with eating disorder, their relatives who have eating disorder, they tend to be 4 to 5 times more likely to develop eating disorder. Again, no clear science to explain, if it is inherited, but certain personality traits that may make development of eating disorder. Rather than directly connecting to the genes, some personality traits could influence. And again, some non-specific traits like emotional instability, impulsivity could be contributing to eating disorder. And neurologically, if you look at low level of serotonin activity, that could also found or contribute to eating disorder. And psychological factors, like mentioned earlier, low sense of personal control or self-confidence. Like Phoebe, even she was such a great performer and achiever in her life, she continued to equate her success with her body size and shape. And having this perfectionist attitude can also lead to contribute to eating disorder. Distorted body image, preoccupation with food, or mood intolerance, not being able to take minor frustration, or low frustration tolerance could lead to eating problems. So here you see that the discussion about cause of eating disorder is talked a little backward, because there's more influence from social dimension than biological dimension. Now, what works well for eating disorder? Well, several psychosocial treatments are effective, including cognitive behavior approach. Based on the current research, we know that drug treatments are less effective for eating disorder. Although some newer research with SSRI looks promising, particularly for binge eating disorder and bulimia disorder. The hardest one here to treat is anorexia nervosa. For example, antidepressant, tricyclics and SSRI help reduce frequency of binging and purging behavior, and they could restore weight but not prevent relapse, so partially successful. And in general, it's hard to treat anorexia with medication, at least for now, because it shows ineffectiveness when you use medication. SSRI are good for bulimia for temporary relief, but again, in terms of long-lasting effects, it's still not the best solution. So that's where we turn to cognitive behavior therapy or psychosocial therapy, talk therapy, right? Now, when you say cognitive therapy, usually it is the therapy of choice, cognitive therapy for eating disorder. And what happens here is they try to tackle the core pathological mechanism, which is distorted body image. And this is mostly psychological factor. It's the mechanism that makes people go for or develop eating disorder. And studies of the effectiveness of cognitive behavior treatment for bulimia nervosa have demonstrated that significant short and long-term gains in reduction of binge eating and purging. So when you choose cognitive behavior therapy, it seems to work better because it addresses the perception and the core belief about their body image. And the most important and immediate goal in the treatment of patient with anorexia nervosa with cognitive behavior therapy is typically gain weight, but not just too fast, but steadily. That could work as well. And if you look at bulimia nervosa, cognitive behavior therapy seems to be effective. An important aspect of CBT approach to treating bulimia involves changing patients' dysfunctional thoughts regarding their weight and previous weight control strategies, which is purging or compensatory behavior. In addition to that, interpersonal psychotherapy, another treatment approach, is also shown to be as effective as CBT. When they compared a study with CBT and IPT, interpersonal psychotherapy, for treatment of bulimia nervosa, they showed that 1 year after treatment, of course, CBT was superior to IPT. However, one interesting result showed in research that comparing CBT and IPT for bulimia nervosa, that in the finding for CBT is more effective in short term, but IPT patients seem to catch up and will do as well as CBT patients 1 year after treatment. What does that mean? Well, these two treatments actually focus on core problems. CBT focus on the belief, the attitude about body image, and also the distortion related to thoughts. IPT address on skill deficit, relational problems, which seem to be the core cause of eating disorder, and how the role, societal role and family role contributes, and what kind of skills seem to be developed in people with eating disorder. In addition to this, there are some self-help techniques seem to be effective for binge eating disorder. Cognitive behavior therapy can be used without therapists. Just a self-help textbook can be useful. And they found that patients with binge eating disorder, they seem to respond really fast. Within 4 weeks time, they tend to show good response to therapy and seem to maintain. So in general, when you talk about psychotherapy, we're trying to gain weight for these individuals. First and easiest goal to achieve, and then provide psychoeducation. Comparing with other individuals, Socratic questioning, we're trying to tell them how their belief about their success and their beauty is not always tied to their body size and shape. And they try to target what kind of food they're taking, the gaining weight, body image, thoughts and emotion involved in that. Many clinicians suggest that the most difficult part of treatment, especially in eating disorder, is anorexia nervosa. And the part of treatment where many anorexia nervosa individuals with this disorder are not successful because changing their attitude regarding body shape and addressing interpersonal disruption in their life seems to be very difficult. And that's why we might need more research to find out what works well. And CBT has such a strong backing from research, and still it seems to be not the best or most effective treatment for AN, anorexia nervosa. Now, outcome research regarding the long-term suggests success of treatment for eating disorder shows that patients with bulimia nervosa tend to have better prognosis in compared to anorexia nervosa. So that is extremely important information here. We try to challenge their belief. We try to challenge what kind of cognitive distortions they have. And by addressing them, we're trying to move them away from their perception of self, perception of their success tied with body image, and move them toward more healthier choices, and perhaps eventually manage the problem, manage the condition. Of course, there is a chance of relapse in any treatment. However, research shows that psychotherapy like IPT and CBT seems to have better promising outcome in compared to solo use of medication. Okay, so that's on treatment, and we'll talk about sleep disorder in next meeting.